Hi, this is an instructional video about how to use your new home whitening kit. Before we get started, it is important to note that we recommend two different concentrations of opalescence whitening gel, 16% and 20%. The percentages will determine how long you wear your whitening trays per session. 16% can be worn for up to an hour per session and 20% for up to 30 minutes per session. 10 to 15 sessions is considered a full course of whitening. You can stop beforehand if you feel the colour is white enough. Otherwise, at 15 sessions, that's about as white as your teeth will get while using this method. The effects are cumulative, meaning that it's better to count the sessions rather than the days that have passed. For example, if you do a session every second day, the results will be the same as doing it every day. It'll just take twice the time. The main side effect of whitening is sensitivity. This generally only lasts for a few days after the most recent session. The easiest way to manage sensitivity is to stop whitening for a day or two before continuing to the next session. If needed, you can apply Sensodyne toothpaste in the trays as you would with the whitening gel and allow the Sensodyne to infuse into the teeth for 15 to 20 minutes. Occasionally, some natural white spots can be highlighted during the whitening course. These spots generally blend in after you finish the whitening and may take 1 to 2 weeks. After you've achieved your desired level of whitening, be sure to avoid pigmented foods that may interfere with your current process. Avoid red wine during whitening as it will stain your teeth. For the first 3 to 4 days of whitening, avoid heavily pigmented foods like curry and red pasta. You can drink coffee, but be sure to rinse or drink water afterwards. And if your teeth become sensitive while whitening, avoid any cold drinks. Along the front of the trays, apply small blobs of opalescence gel. Make sure to only use 1/3 of the tube per session. We recommend that you only apply it on the teeth that are most visible when you're smiling. Once you have evenly distributed the gel, place the tray onto the teeth to achieve an even coating of whitening gel per tooth. Use your finger to adapt the tray to the teeth if needed. There may be some excess whitening gel which overflows to the gums. If this is the case, use a cotton tip or your finger to wipe off the excess gel so that there is minimal in contact with your gums. This is to avoid any form of irritation. After wearing your whitening trays accordingly, take them off and gently scrub with a toothbrush under cold water to clean. Do not use hot water as it will distort the shape of your trays. Once it's clean, leave it to air dry out of direct sunlight until your next whitening session. Brush your teeth as normal to clean away any excess gel. The gel is formulated to be safe in case you swallow small amounts, but obviously the less the better. If you have any questions or concerns, please be sure to get in contact. Otherwise, enjoy whitening and we look forward to the results.